Well, good afternoon, everyone. It is the top of the hour, and we are filtering into the room. We're so excited to have you here for our November edition of the Early Efforts webinar. We're going to give it about 60 seconds to let everyone get into the room, and we will be underway. But we're so glad to have you with us. All right, well, why don't we kick into gear? It is so good to have all of you with us for the Early Efforts webinar from the Hunt Institute. My name is Dan Worry. I am the Senior Director of Early Learning at the Institute, and for the benefit of anyone who may be joining us for the very first time, the Hunt Institute is the creation of our founder and namesake, Jim Hunt, who was the four-term governor of North Carolina. The Hunt Institute is an education policy resource to America's governors and state lawmakers and other high-level state elected leaders. We cover the full spectrum from prenatal on up through workforce, but here on our Early Efforts series, we are focused on the early childhood portion of this continuum, and we are so excited today to welcome this terrific panel to discuss family childcare. If you are new to that term, probably not, but if you are, family childcare refers to programs in which childcare providers care for typically smaller groups of mixed age children in residential settings. Family childcare is a really critical part of the nation's childcare infrastructure, offering in some cases non-traditional hours for families who may need care outside of the regular 9-to-5 workday. In some cases, more affordable care options, care that reflects families' cultures and or languages. And it is also a really critical part of the nation's rural child care infrastructure. As the industry continues to recover from the impacts of the pandemic, it is more important than ever for us to consider the benefits of family child care and for states to be providing the necessary supports for those providers. And to help us understand more about family child care and where the nation is innovating, we are excited to be joined today by four experts in the field. They are Erica Phillips, who is the Executive Director of the National Association for Family Child Care, Jessica Sager, the co-founder and Chief Executive Officer of All Our Kin, Kathleen Merritt, who is joining us from Colorado's Bright Futures for Early Childhood and Families, and Paul Major, who is the president of the Paradox Community Trust in Telluride, Colorado. It is so great to have all four of you with us. Before we get going on our conversation, just a quick couple of housekeeping items. First off, later in the conversation, we will be turning to your questions. And so if you have a question for the panel, we invite you to enter them not in the webinar chat, but in the Q&A function at the bottom of your Zoom screen. That'll help us to separate out sort of the chat from the questions. Definitely do invite you to use the chat though throughout the hour. Welcome you to introduce yourself. Tell us where you're from. Also, as always, our Early Efforts web series is closed captioned for the hearing impaired. And so if you would find access to closed captioning useful, please feel free to access those settings. You can find the closed captioning settings down also on the toolbar at the bottom of your screen. Finally, you will be able to access all of today's webinar on our website and our YouTube channel here in the next couple of days. So with that, There we go. I was going to say I was going to flag that. Looked like maybe the chat wasn't moving as lively as it typically does. Looks like we got the chat squared away. So please do feel free to introduce yourself. Let us know where you're from, and we're so glad to have you. I'm going to go ahead and kick into our conversation, beginning with Erica Phillips. Erica, you are, as I mentioned, the executive director of the National Association of Family Child Care, which advocates for the needs of practitioners and the families that they serve. Help us sort of ground and start this conversation by talking to us a little bit about why and how family child care is critical to our early childhood landscape in the country, and maybe to share a little bit about how would you assess the state of family child care in this moment?
Stan, that is a great question. And first, thank you to you and the Hunt Institute for coordinating this important conversation on family child care. I am really excited to be here. So the first thing I'll start with is that families want and need family child care. We've known that, and we saw that through the pandemic, how incredibly important they are. We know that more children spend time in home-based childcare than any other childcare setting. And family child care educators disproportionately care for infants and toddlers, children from low-income families, families of color, including Black, Latinx, and Indigenous families, immigrant families, as well as families living in rural communities. And families choose family child care for a number of reasons, particularly because of its flexibility, its ability to provide care during non-traditional hours, its nurturing environments, and the opportunities it provides to support the child's home language and culture and to be in a mixed age setting. Unfortunately, as the rest of the pandemic has recovered, the supply of family childcare is declining, which started well before the pandemic. Child Care Aware of America recently found a decrease of 10%, 10,000 family child care programs in the last 2 years. This is on top of the more than 97,000 family child care programs, approximately 25% of our capacity, that was lost in the 15 years preceding the beginning of the pandemic. And three core challenges have intersected to contribute to the former educators' decisions to leave the family child care workforce. One, challenges with the early care and education systems. Two, the economics of family child care, resulting in many home-based child care providers who, as sole proprietors, often make below minimum wage. And three, the working conditions, which include long hours, physically demanding work, often done in isolation from other adults. And this results in decreased capacity, longer waiting lists, and fewer children and families with the care they need. So this is not the time to tweak, but really the time for larger changes to address the needs of this critical part of our early care and education. So it's important to dig in and understand what can keep family child care educators in the field. And in 2021, there was a study, the Family Child Care Educators' Perspectives on Leaving, Staying, and Entering the Field. And they talked to educators who remained open and asked them what supports helped them stay in the field. And the most frequently cited support was peer support, including informal networking or more formal peer support groups or state and local family child care associations. And while we absolutely need to address the compensation and administrative burdens, we can't overlook the fact that creating communities is often what sustains family child care educators in this work. And I'm really excited about the role that the National Association for Family Child Care can play in sustaining peer support groups and building grassroots leadership and reversing the decline in supply of family child care programs. So since 1982, we have been supporting family child care throughout the country as educators make the intentional professional choice to offer high quality early care and education in their homes. We provide opportunities to family child care professionals with a special focus on family child care leaders to connect and grow through membership at NAFCC. Second, we promote the usage of NAFCC's family child care home-based centered standards for accreditation and increase the number of family child care educators recognized for meeting the highest standards for home-based ECE. And we also serve as a national leader elevating the voice of family child care. So to your question around assessment, we are internally optimistic despite this being a difficult time. And I wanted to share 3 reasons we're optimistic about the future of family childcare, despite the statistics I shared earlier. First, engagement and leadership among family childcare practitioners is accelerating. Family childcare educators have increased their engagement in family childcare-led associations and unions and family childcare networks. And educators are demanding more respect and compensation for our profession that will allow for a living wage, strong health benefits, retirement savings, and the ability to build wealth. And recently, we have seen more movement towards providing these type of accommodations for family childcare educators. We've seen educators in the state of Washington, DC, and California have the right to participate in retirement plans or receive additional funding for participating in not retirement, but in health insurance. Second, we believe that family childcare will become a more typical setting for publicly funded early learning, including pre-kindergarten. During the 2019-20 school year, about half of state-funded pre-K programs technically allowed family childcare to participate and receive state pre-K dollars, though the requirements for most of those programs made them inaccessible for most family childcare educators, resulting in less than 1% of children in pre-K actually being in family childcare homes. So we have to find ways to include and promote the unique strengths of family childcare programs and state-funded pre-K programs that will result in rich early learning settings, strong caregiver-child interactions, and opportunities for learning in real-life environments with mixed age groups. Pre-K programs can use standards like the National Association for Family Childcare's accreditation standards to ensure that publicly funded programs support child development and early learning, while also minimizing the risk of pushing out educators with years of experience or those who may speak a language other than English. The third thing that we're excited about is that there are many promising innovations like family childcare networks, shared services models, appropriate uses of technology, many of which you'll hear about later today that will lead to increases in family childcare supply and higher quality business and program models. So overall, our assessment, and this is just one person's humble assessment, is that the pandemic really did reveal the importance of family childcare. And we do envision a future where family childcare is no longer invisible and fragile, but can serve as a leader in the ECE world.
Erica, thank you. You unpacked so many important points that I want to follow up and have more conversation on, but I definitely want to get to the rest of the panel and then we'll circle back on some of those things. But before we do, you did raise one really important point that I wanted to give you a second maybe to unpack a little bit more, which is, there has been a lot of attention to the compensation crisis in childcare writ large right now. And so, it is not uncommon for people to see articles and analyses that talk about the childcare workforce in the nation making sort of at or very near minimum wage. But you raise an important point about family childcare providers in that in some cases they may be making less than minimum wage. And so for people that maybe are newcomers to this conversation, I'm sensitive that may strike them as an odd idea, that how could somebody make less than minimum wage? Take a second just to unpack why that is.
Right. So most family childcare educators are sole proprietors. They are independent business owners who rely on both the fees from families, childcare subsidy, maybe money from the CACFP, the food program, in order to cover their expenses. And their expenses are things that include modifications that they make to their housing, an assistant, if they bring in an assistant to come into their program. So at the end of the day, most of them are not protected by the same protections that employees get, but because they're independently doing this in their homes, their families are living off of what is left at the end of the day. That's why it's so important that the tuition or the childcare subsidy, or that the food program is covering those expenses so that they have enough to pay for things like not only their family's expenses, but also retirement, health insurance. Those are also expenses that they all incur on their own, unless they're in some type of system that provides additional supports, which most providers don't have access to.
Great, thank you so much for I thought that was an important point to shed a little bit more light on, maybe for people that were newcomers to the conversation. Jessica, want to turn to you. You are the co-founder and the CEO of All Our Kin, which is an organization that works to train and support and sustain family child care providers across the country. Talk to us a little bit from your perspective. In what ways are states, and maybe can states and local communities best support the unique needs of family child care providers, and maybe where are you seeing particular innovation happening here?
Yeah, thanks, Dan. I am really glad that we're having this conversation. So, as you mentioned, at All Our Kin, we train, support, and sustain family child care educators. We work with about 1,000 educators in New York and Connecticut, and we're training agencies in another 22 states in our model. We've shown that when you invest in and support family childcare educators, you create sustainable, high-quality programs. And when you do that, everyone wins: educators, parents, and especially children. So how do you do that? Well, as we've already been discussing, the first thing is to look at educator compensation. Educators are professionals who are building young children's brains, and we need to pay them fairly. So in family childcare, we just sort of cracked this door open. What does that mean? Well, it means looking at your state's subsidy system and figuring out how much you need to pay per child to add up to a fair and livable wage. It means looking at opportunities like stabilization grants and other funding opportunities and making sure they are designed to include family childcare educators. It means thinking about things like health insurance and retirement benefits and how to open those up to family childcare. And it means including family childcare educators in other funding streams like pre-K and early Head Start. And I will actually come back to that in a moment. So compensation, that's number one. Second, professional learning systems. Do family childcare educators in your state have opportunities to access professional learning in the way that other childcare teachers do? Are you including them in your trainings? And are you creating learning opportunities tailored to family childcare educators, like trainings on how to run mixed age group settings or how to run family childcare businesses? And maybe most important of all, do you expect family childcare programs to look like tiny centers? Or do you look at what the brain research actually tells us and recognize that what you should really be looking at is how adults interact with children? Because then you can create a definition of quality that recognizes the unique strengths of family childcare educators and supports their success. And you can train your staff to take a strength-based approach to coaching and training educators, honoring their knowledge and their skills. In fact, we've seen at All Our Kin that the educators we support in this way score over 50% higher on research-based observational tools. And once you begin to think this way, which again is what brain science tells us to do, you'll find that including family childcare educators in pre-K and early Head Start absolutely makes perfect sense. Third, licensing. It's really important to have standards that make sure children are healthy and safe, but we also want to be sure that our licensing systems don't create artificial barriers and that educators have support in navigating the process. In Connecticut, we partnered with the Office of Early Childhood to make reforms to the state's processes that cut the licensing time in half without compromising health or safety. And we work to support educators in becoming licensed, leading to a substantial increase in supply. Fourth, a professional community. Erica spoke about this. It is really hard to be a family childcare educator for so many reasons, but it's even harder because of the isolation. You are often the only adult in your program. Like any professional, family childcare educators need support. This can come from staff at family childcare networks, childcare resource and referral agencies, provider-led associations, or other hubs. It can also very much come from peer support. Creating opportunities for family childcare educators to come together is a key role for these groups. And so is making sure that educators, children, and families have access to comprehensive services, mental health services, physical health, agencies serving children with developmental delays. Finally, and most importantly, states can make sure that educators help to design the systems that affect them most profoundly. Educators are experts. They know better than anyone how regulations and policies impact their programs and how they impact the children and families in their care. Educators should be engaged in every aspect of planning, not just giving feedback once the system is designed, but helping to shape your state's vision from the very beginning. That is a lot, and I know we're going to unpack a lot of this later, so I will pause there. Thank you for having me.
Jessica, thank you. And why don't we'll turn to one of my very favorite parts of the entire country. Both Kathleen and Paul represent the communities right around Telluride, Colorado. Kathleen is the executive director of Bright Futures for Early Childhood and Families, which, as I mentioned, is based in Telluride. You have supported early childhood education in the region. Talk to us a little bit about the role that family child care providers play in your community and how Bright Futures is supporting them.
Yes, absolutely. Thank you. So family child care, this model plays a very important role for families and children, especially when you're looking at rural settings. So really this saying that everyone depends on someone who depends on childcare has never resonated more, because we have most families in today's society depending on two incomes to make ends meet. So having access to the family child care model is absolutely necessary for most families to get by today, not only in our region, but throughout the country. And Bright Futures is, our main office is situated in Telluride. However, we do cover a 9,000 square mile region of the San Juan region of Colorado. And we really act as that local support to all licensed childcare and family friend and neighbor. But we do have a focus on family childcare home operations, offering various technical assistance supports, coaching, as well as navigation and really individualized professional development opportunities that really meet the needs of the family childcare home providers in our region. As already stated, we know that family childcare home providers are really playing a critical and important role in the early care and education in our communities, being able to serve those mixed age groups, being able to offer flex hours. We also see with the family childcare home model that they have deep connections with the families they serve. Because the owner and operator is not just the owner and operator, she's also the lead teacher in the classroom. So the family really does have access to the person primarily caring for their child. We've really been working to scale up this family childcare home model here in the region. We do live in a childcare desert, and we do see this as a sustainable way forward to provide this critical service to working families while also providing quality care and education to our youngest learners during the most critical time in their brain development. So, we definitely are providing them with an array of supports and are looking forward to offering additional supports by way of family childcare home navigation here in the next coming months that we'll bring that up towards the later part of the conversation. Thank you.
Well, Paul, let's turn to you. You know, we mentioned during the opening, and Kathleen just mentioned, you know, one of the places in the nation that we see the the largest number of childcare deserts, obviously, is in rural communities that may have a a dearth of center-based care. You know, one of the other places that we see very substantial childcare deserts, maybe much to some people's surprise, is in some of the more affluent communities across the country. San Francisco, for example, and cities with very high costs of living tend to have some real challenges when it comes to childcare because, as we know of the model generally, it is not the most lucrative profession, and it is difficult in some cases for not only for providers to get businesses established in some of these communities, but for childcare providers even to afford to live in some of those communities. And Telluride may actually be a unique example of both a community where there is a high cost of living, but also a rural aspect to the work as well. And so, over the past 20 years, you have served as the president and CEO of the Telluride Foundation, now serving as the president of the Paradox Community Trust. I know, over this time that you have made significant investments in early childhood, and really excited now that you are leading this new initiative that is connecting affordable housing and family child care. Share a little bit with us about this project and how it works and what you're learning so far.
Thank you, Dan. And yeah, I'm a bit of an odd duck in this group. I'm surrounded by experts, so I'm honored to be part of this. But this will give us a new kind of twist to this conversation. So Paradox Community Trust, we're essentially a residential home builder. And this actually was incubated at the Telluride Foundation. We spun it out this last year. So we're building homes in rural communities, small rural communities, priced essentially for local teachers. So we're trying to re-engineer this. So if you think about the average salary for a teacher in the public school system in Colorado is about $47,000. That translates to about the ability to buy about a $250,000 home. There's not a whole lot of $250,000 homes being built, like there's none being built. So is there a way to sort of attack that problem? So that's our primary focus, is to build houses that are priced for the critical local workforce. And whether it's a teacher, whether it's a pre-K teacher, an early childhood provider, a deputy sheriff, somebody that works in government, so on and so forth, a nurse. All of these people have good jobs. They're the critical infrastructure of a community, and yet there's no place for them to lay down roots in home ownership, or even in rental, in often cases in renting. So my past work at the Community Foundation funding center-based care, which is the economics just don't work very well in rural communities, center-based care. So we said, well, how about family-based care? So essentially we're trying to combine these two crises together to see if we can come up with one solution. Let's try to solve that affordable housing crisis and solve the home family care crisis. So could we build homes that are ready to go with people that want to either start a new family home care operation or are moving from a rental situation or FFN or all the myriads out there into a home, whether it's a rental home or rent to own or for full ownership. But we do know one thing: if we can get a provider into a house and we can lower the cost of that house, whether it's rent to own or buy, we can lower, frankly, the cost of delivering care. And we can, frankly, increase the income generated for that provider, which is really the goal here. We are living in an era where the people taking care of the most important, or the youngest kids are getting paid the worst, treated the worst in our entire system. So is there a way to, connect housing and being home care provider together to try to solve this crisis at the same time, or the same two different crises at the same time. There is a ton of money coming into affordable housing in one form or the other across the country, because it's a problem everywhere. There's not as much money moving into early childhood across the country. It's, drips and drabs here and there. We obviously don't have a federal program that really brings the level of subsidies to the table. So can we, again, get developers, and we're just one developer, can we get developers to proactively think about building houses or building, units of housing that are ready to go for family home care operations, and whether that's licensed, and there's a very high bar in licensing in the state of Colorado. So there's a lot of things that we have to think about, bigger yards, fenced in yards, separate bathrooms and lighting and access and all of that. Or is it just FF&N where somebody can, basically have a safe, comfortable, affordable house, and they can provide care to a few kids in the neighborhood, but eventually maybe move into some level of licensing and getting all of those benefits. So it's a pretty straightforward idea that we need to try to solve both of these crises at the same time, housing and childcare. And we need developers to proactively think about incorporating home childcare operations in whatever development they're doing. An apartment complex, a suburban subdivision, but we need that to be integrated into it. Where we are right now is we're actually dealing a lot, or we're trying to deal a lot with just the financing of how do we finance a provider that is often low income. Sometimes they're not banked. They don't have any banking history. They may not have a credit history. They're, an independent contractor. So how do we get them into a financial product that they can actually buy a home or rent to buy a home? So that's not walking up to your local bank and saying, I need a 7.5% 30-year mortgage. It's coming up with some creative financing options for people that are often fantastic providers of care, but don't have all of that financial wherewithal that you would need to get a 30-year mortgage, and certainly not a 30-year mortgage at 7.5%. So a lot of our effort right now is first dealing with the financial barriers for the provider to get into home ownership or rent to own. Once we do that, we're then going to essentially run an accelerator to try to attract some providers that for our new subdivision that we're building, just one subdivision in Ouray, Colorado, and then run them through a accelerator to give them all of the care and education acumen and the business acumen to start a business day one. So we're super excited. Lots of partners in this. Again, my job is to build the homes and to do it affordably. But I'm tagging along with a lot of great people. And this is a great idea. This is, family. The more I learn about family home care, the more excited I get about, we're not just building a subdivision, we're building a neighborhood that will be, be providing care to people that live in that neighborhood. So that's what we're working on. And again, look forward to some questions.
Well, there are a couple in the chat, Paul, that have popped up here, and so I thought maybe worth raising them while we're on the topic. One question came up about how are you as working with both developers, but also with Colorado's licensing entities to make sure that as we're developing this housing, that it's going to be fit for licensure in the state.
So we have a very tough licensing process in Colorado. It's very prescribed. But it's very straightforward. But we've also talked to them, and they want this to work. They see the opportunity that if they could create an approach where it's it is going to be a challenge for developers. They're going to go, oh God, we got to have a bigger lot and more fencing and little toilets and all kinds of, scary things that a developer doesn't want to deal with. We can make it easy for a developer, and the state is very supportive of that. But the state is, they're stringent on their licensing, but we've had multiple conversations with them. They're excited to see if they can help pilot this project. Kathleen's on the front line of this with the licensing department. We have a new director of early childhood for the state. She's been very supportive of the idea. So with any new idea, you need everybody to come to the table ready to see what we can learn together and apply and adapt.
Thank you, Paul. And one of the things that has not come up at in depth at this point that I know is also an issue, and maybe can throw it out to the rest of the panel as well, in the creation of family child care programs, is that local zoning ordinances sometimes can create a real challenge, even to to potential child care entrepreneurs who are looking to begin family child care businesses. Jessica, what are you seeing around zoning, for example?
Yeah, I'm so glad this is coming up because it's so often invisible, these twin issues of housing and zoning. And I've seen so much in the chat about the inability of family child care educators to open. Well, the first thing I want to name is that often landlords illegally discriminate against family child care educators, and in fact will try to evict them. Sometimes that's because of mistaken assumptions about the health and safety of programs, even though there's no evidence to support that. And in fact, it's great to have a family child care in your neighborhood because, as Paul said, it makes your neighborhood thrive, right? But also sometimes it's because landlords don't want the state to see how unsafe or inadequate their housing stock is, right? So it's in all of our best interest to make sure that landlords are not able to discriminate against these critical businesses. We see this come up in zoning as well. We see local zoning councils that are refusing to permit family child care programs to open. In Connecticut, sometimes we see that even though our state zoning requirements say that cities are not allowed to do this. Sometimes these are explicitly racist practices. Sometimes they're grounded in other forms of discrimination. But in every case, it's keeping childcare out of neighborhoods where it's desperately needed, and it's keeping business owners from operating their businesses. So we at All Our Kin have really been advocating for broad state level and maybe even federal level bills that could prohibit these kinds of housing and zoning practices. And in your state or your city or your town or your locale, if you want to expand the supply of childcare, I suggest that you take a hard look at what landlords and local zoning and planning councils are doing to keep childcare providers out.
Erica, Kathleen, anything you want to add on that, on the zoning or housing?
Just one small thing on that. So we work with family child care leaders across the country, and this is something that comes up very often. The participants in our leadership program were able to come up with a community project, and one of the most frequent ones, I think top 4, was around housing and zoning. And not only, as Jessica talked about, having more awareness around landlords, but also having more consistency in the city level or county level administrators that are looking at the zoning requirements in their community, making sure that one provider in one area is not treated differently from another provider in another area are some of the concerns that they raised. And so it is very unique to family child care because they rely so much on housing in order to provide their care and business, and something that we've seen challenges. I know that California also passed a legislation that was lauded as being able to address some of these issues. And I see in the chat, Colorado also has a legislation that was passed that should help to address that. And we'd like to be able to see that really across the country because it is a trend we hear a lot about.
I was just going to chime in. It's indefensible to try to shut down home childcare businesses, in neighborhoods. I mean, and so it is racist, and it's multiple, equity, just go down the list. And so, I hope these issues get surfaced, and the politicians that need to correct them need to get on it. To say that you require a parking spot for each child, I mean, that's just absurd. And, we've got to take these things on. There's enough stupid things going on out there. We need to deal with them. So sorry, but zoning is, there's a lot of exclusionary zoning out there, and HOAs are typical, but I saw some stuff in the chat that I think in Colorado, HOAs can't put an undue burden on a home family operation. But all of those rules that restrict the ability for a neighborhood, a community to provide childcare, we've just got to take those rules on and expose them for what they are.
Want to get here in just a moment to some of the questions and answers that are popping up in the from participants. If you have a question for the panel, please do put it in the Q&A down at the bottom of your screen, and we'll get to a few of those in just a minute. But Erica, before we move on, I want to ask a question. When you were sort of giving your opening answer, you talked about how family child care in many states are sort of technically able to be part of a mixed delivery system for pre-K, for example, but that in practice that doesn't always necessarily play out maybe in the way that it looks on paper. What what do you see as key for our helping to better integrate family child care into these broader state early learning systems?
Absolutely. I think we know some things we're still learning, particularly around pre-K, because there has been such an expansion and now more moves to integrate family child care educators. One of the things that is most important is to make sure that the resources are truly tailored to the home-based setting, and that is not going to force a program to create a mini center in their family child care program, but instead really sees the opportunities to have mixed stages together, sees the real life setting that can come in offering high quality childcare in a home-based setting. And one of the most important strategies or most effective ways that we can ensure that is to invest in solutions from family child care leaders to make sure that family child care educators themselves are at the table and are able to look through standards or look through requirements to better understand how something is going to impact a family child care educator in the field. So, earlier I talked about the importance of the peer support pieces and integrating family child care educators into broader early learning systems using some of the networks that already exist. And across the country, there are, for example, family child care associations who have partnerships with either Department of Educations or Department of Children and Families in order to play that role of representing family child care, of actually providing program services, mentoring, scholarships directly to family child care educators that really meets their needs. And so we are one of the things that we're paying the most attention to is in communities that have funds to support family child care in the broader early learning system. How do we tap into the leadership of family child care groups who are already on the ground? How do we, make sure whether or not it's an association or unions or family child care committees of AEYCs, that those leaders are at the table and are actually getting some of the funds in order to provide technical assistance, because a family child care educator is going to have the most real-time feedback and support and information about how to best support the other educators in her community.
Why don't we shift? We've got a whole stack of questions in the Q&A from the audience, so let's get through as many of them as we can here before the end of the hour. Maybe some of them on some similar themes, so I may combine a few of them. Sandy has a couple of I think just sort of orienting questions about family child care, so maybe I'll lump these two together. Erica, Jessica, maybe you know the answers to these questions. First off, she's asking, what percentage of all child care nationwide is provided in family child care settings? Is that a figure that you have on the tip of your tongue?
Yeah, I'm happy to answer that. So there's two ways to look at that. The first is children who are receiving care in a home-based setting. So about a third of children from 0 to 5 receive some type of care in a home-based setting. Much of that is actually not paid. It is family, friend, and neighbor, or in unlisted programs where maybe somebody is receiving money for that, but because they're only caring for one child or in a very restricted way, they're actually not in the listed. So a third of children 0 to 5 do receive some type of care in a home-based setting. The other way to look at that is the capacity, so of licensed childcare. And for licensed childcare, family childcare is about 20% of overall capacity throughout the country. That looks very different. The licensing requirements look very different across different states. There are some places where you can have a handful of children and not have to get licensed, where other places, as soon as you have more than a couple of children, you would have to get licensed. And so it looks very different across each state.
Great, very helpful. And I think you answered Sandy's other question as well about how differences in licensing requirements for family child care providers. Question from Angela about how, and I'm not sure actually which of you this is for, but maybe you could each weigh in on this, because I think it's pertinent to each of your organizations. How do you find the family child care providers that you enter? Maybe Kathleen, would that be a good one for you to start in Colorado?
You broke up a little there. What was the question?
The question was, how do you find the family child care providers that you end up working with?
So in Colorado, we serve as an early childhood council. So we are a state designated organization that supports childcare in the region. So we do have access to all of the licensed family childcare home operators through a database. And we also have a very close working relationship with our regional family childcare home association. And we run a Parents as Teachers home visitation program, which has really opened up access for us to be able to engage with that more informal network of family, friend, and neighbor care as well. So that's how we engage with those folks.
Erica, I know NAFCC is a member organization. How do family child care providers get involved with your organization?
Absolutely. So the most effective way to reach other family child care educators is really through word of mouth. Often there'll be one champion in a community who wants to be able to bring more services, more networking to those in her community. And when you identify who that leader is and provide them with materials, support, compensation, if that's available, then she or he, but mostly women, are incredibly effective in organizing other family child care leaders. And so that is one of the most effective ways that we connect with providers, through word of mouth. In addition, some are interested in having the accreditation sort of seal of excellence and will come because they want to be able to show to their parents, this is what I do in my program. This is how I'm ensuring that your children are developing. And so that's another reason that educators might reach out to NAFCC.
And Jessica, give us a little background on All Our Kin in that regard.
Yeah, I mean, this is such a great question. And actually we get asked this all the time. So when All Our Kin comes into a new community, I mean, the first thing I'll name is that we hire staff who live there, who are part of the life of the place and who are present at local events and are connecting with parents and educators everywhere that they are just organically, but also will go to a story time at the library or a parent teacher night and just talk to kind of everyone who will listen. So being present, that's number one. Number two, trusted messengers. So whether that's faith-based organizations or workforce training organizations or family resource centers, again, working with trusted messengers to spread the word about your services and what you're offering. And the third, no question, what Erica said, word of mouth. If you are offering responsive services and supports that are driven by what educators need and that are high quality, the word will spread really, really fast, and sometimes over further distances than you might expect. When All Our Kin first opened in the Bronx, we didn't think anyone there knew us yet. It was a rainy night. We were in the basement of Lehman College in the Bronx in a classroom almost impossible to find. We thought 5 educators would show up and the room was overflowing because the word had spread from Connecticut that All Our Kin was coming to town. And, whatever you do, good or bad, those echoes will reverberate out, and educators who are super insightful leaders will champion the work that they think has value. So it may take time if you're in a brand new community where no one knows you, but if you engage in authentic partnership, the word will spread.
Jessica, thank you. And Paul, in terms of this pilot project that is happening now in Telluride, what I would imagine that the combination of affordable housing and an opportunity to create a family childcare business would be very appealing. And it wouldn't surprise me to hear that you had more demand for those sorts of locations than you have availability. How are you helping to select who ends up in those homes?
Well, I think you're right, what you said. The ability to both have home ownership and bring home ownership to your family, but also be able to be an entrepreneur and start a business, much less, that you can take care of kids, which is maybe something that you love to do. So we're hoping that, combining all 3 of those really creates a unique opportunity for people. We with the home ownership, we have a lot of experience with, frankly, reaching hard to reach people. We have 3 Latinx buyers in our first development out of 24 homes. We have 3, and some of them are making as low as 40% AMI. AMI is area medium income, so they're at 40%. 100% AMI is the average medium income for a county. So these are low income individuals. They live and work and raise families in the community, but we're able to get them into home ownership. And then if we could leverage that to, similar people to start home operations, it's a very virtuous opportunity to connect all of those dots. So the first thing, like Jessica said, you've got to have, authentic leaders in the community. So we have a very strong outreach in the Latinx community, which is our primary people of color in our region. But you've got to do everything right too. You've got to make sure everything's translated. And again, a lot of these people don't have credit ratings, they're not banked, they don't have savings, but you've got to bring all of those tools to the table to help them get into ownership, home ownership. But you also need to bring those tools to the table to make sure they start a great home childcare operation, which we have those tools, as you can see from this group. So it's really just packaging it together, and I think we will have a lot more people than then homes available, but that's the whole point.
Absolutely. Jessica, a question in the chat for you. You had mentioned earlier that a need to increase levels of childcare subsidy for family home providers. And Rebecca is asking whether you've seen any innovations in the states in this space in particular. Are there states that are taking steps to address rates specifically for family childcare providers?
Yeah, absolutely. So this is such a hugely important topic. And there is actually a movement underway to change the way we think about the subsidy system. So the federal government says you can think about it two ways. You can do a market rate survey where you ask educators what they charge, and that is worthless because educators charge whatever the subsidy is paying. So it's a cat chasing its tail. The other way you can do it is a cost of care. You can say, how much does the educator take in minus their expenses? You divide that by the number of children and you say, what do we have to pay per child to get to what we think is fair? You could say that's a livable wage. You could say it's what kindergarten teachers earn, since after all, both groups are engaged in the work of building young children's brains. If you actually take that number and you divide by the number of children, you will get a number for your subsidy that I guarantee you is very far from what you are paying now. And maybe your state can't get there today, but it gives you something to work for. So there are a number of states, including Louisiana, including New Mexico, including Connecticut. I mean, the list goes on and on of states that are saying, we're going to do a cost of care study and we're going to hold ourselves accountable for at least naming what we should be paying, which is not getting us there, but it's a necessary first step. So if your state is not doing that now, I would say, tell your state to do that starting today.
That's a really important point, and definitely a growing trend across the country. Those of you who've been watching carefully may know that both the Democrats' Build Back Better legislation in Congress and the proposed Republican reauthorization of the Child Care and Development Block Grant actually encourage or would require states to start moving away from that market survey methodology of setting subsidy rates and really looking at the actual costs of care as a means of determining those subsidy levels. Another question in the chat, Erica, this may be a good one for you. Elizabeth is asking about a challenge as a child care provider to get liability insurance to cover them. Says, I've researched this somewhat. Are there insurance companies that cover home-based child care providers? I'm talking about the kind of insurance that would cover you if something happened to a child in your care, for example. Centers usually have this kind of insurance, but it is difficult in some cases for family child care providers to access. Any thoughts on insurance coverage?
Yes, there is liability insurance providers that family child care educators can pay into for a small fee in order to make sure that they are covered. We provide a lot of coaching and answer a lot of questions around this because for your homeowner, there's a limited amount of insurance that you would have, but that would not cover your entire business if you're running a family child care program. And so we do recommend that people do purchase liability insurance. There's a few different providers of that. I don't know if there's an email that will go afterwards. We can share some of the names of ones that providers have used. To be honest, I would love for that to be something that NAFCC was able to provide at a low cost, but we do have relationships with a number of different providers. And so we'll figure out a way to share that information.
Great, and our time is always running short. We always could use 3 hours instead of 1. But Erica, there's a question Terry had asked that somebody in the chat had mentioned NAFCC's initiative, Leaders Shaping Leaders, and how fantastic that was, and said they'd be interested in hearing more about that. You want to share a little bit about what Leaders Shaping Leaders is?
Absolutely. So knowing the importance of family child care leadership, about 2 years ago, NAFCC launched Leaders Shaping Leaders. It's a year-long learning series designed to strengthen both the knowledge of family child care professionals and also to promote networking and strong connections. So each state, there's a team, there's pairs of family child care providers are typically in the same state. Somebody who has more experience, maybe a family child care association leader, and someone who is newer in the field, they come in together, they develop a community project, they get coaching and training around leading a network or a family child care association together. And from there are able to really make an impact on the family child care supports in their community. So this is in our second year, and we will be launching another application in spring of next year. It's a great way of tapping into leaders across the country.
Very exciting. Well, we are at the top of the hour, and so I think we're going to need to, unfortunately, wrap our conversation up. But I want to thank our panelists, Erica Phillips, who is the Executive Director of the National Association of Family Child Care, Jessica Sager, who is co-founder and Chief Executive Officer at All Our Kin, Kathleen Merritt, who is the Executive Director of the Colorado-based Bright Futures for Early Childhood and Families, and Paul Major, President of the Paradox Community Trust in Telluride. Thanks all of you for taking time out to be part of this important conversation. There was one question in the chat about whether people would be able to access this recording so they could go back and watch it. Absolutely so. You should know that all of the Hunt Institute's webinars, both our early effort series and otherwise, end up within just a couple of days on our YouTube channel. And so if you want to visit YouTube and search for Hunt Institute, you'll find our channel, and you can view, if you like to listen to podcasts or listen in as you drive or exercise, you should be able to find dozens and dozens of past recordings of this series and others. Do want to remind you, we will be back on Monday, December 5th, a little bit of a special time. We'll be on a Monday instead of a Tuesday in December for a special 2-hour event. You may recall we actually did this last year. We're going to have a year-end roundup in partnership with the Alliance for Early Success called 2022's Big Wins for Little Kids. So we will be looking at the major public policy victories around the country for young children over the past 12 months, kind of a special way to end the year, and a special format as well. It's a 2-hour time frame. During the first hour, we will have kind of our traditional webinar format where you'll be able to hear from the panelists. During a second hour, though, we will retain the panelists. We'll break into some smaller sort of breakout sessions, so you'll have the opportunity, based on the particular subject of interest, to actually go and interact directly with our panelists during that second hour. So please do, if you have not already registered, again, Monday, December 5th, 2:30 to 4:30, a special time that day, but we will be recapping some of the year's biggest stories for young children, again in partnership and in conjunction with Alliance for Early Success's annual policy report that spells this out. It's a fantastic resource every year that it really recaps what is happening in all 50 states. So keep an eye out for both that resource and join us on December 5th for that. Again, thanks to our panel, and more importantly, thanks to all of you for taking time out of your busy schedules to tune in and be a part of this conversation. We appreciate you. We wish you a wonderful afternoon, and we will see you on December 5th. Thanks, everyone.